As we mark a year of the pandemic, we're focusing on stories of progress from those dark early days. This time last year, New York City was the epicenter of the virus in the U.S. Since then, close to 1 in 11 New Yorkers has been diagnosed with the virus. Around 1 in 300 has died from it. Hospitals were overrun a year ago due to a virus we did not understand then. And our lead national correspondent, David Begnaud, was on the front lines. David, good morning. You went back to one of those hospitals, David, just this week.
We did. When we first visited the Brooklyn Hospital Center last April, the outbreak in New York City was nearly at its peak. Of the 900 COVID patients it treated in the past year, 700 of them came through the doors between March and May of 2020. So they got hit really early on. Now, during that time, PPE was very scarce. In fact, I'll never forget, when we went inside the hospital, I was head to toe in protective gear. And one of the nurses looked right at me and said, "I want what you have." I just remember turning around and looking at you and thinking to myself, is she really wearing a garbage bag?
Early in the pandemic, I think our institution, as well as every other institution in the world, was blindsided.
That is Nurse Kimberly Ellis. When we met her a year ago at the start of the pandemic.
Look at what he has on, look at what I have on.
She was treating COVID patients dressed like this.
I was wearing a garbage bag over my uniform, and you came in with a beautiful moon suit and a mask, dressed like you were going to space.
I remember how direct you were when you looked at me and said, "What are you wearing?"
Initially, it was very painful because you guys looked like you were dressed safer than we were at the time. I would like a helmet like yours. Or can we have helmets like this for all of the staff? I said I wanted what you had because you looked like you were better prepared for the pandemic. But in all fairness, I don't think anybody was prepared properly in the early part of the pandemic.
But we're past those early days, and things have changed dramatically for Nurse Ellis.
Yes, we'd like you to be here 5:30 a.m. tomorrow morning.
Well, she's back in her original role in the preoperative department after 6 weeks in the ICU last spring. And across the hospital, the number of COVID patients is down substantially.
Let us get back to the things we normally do, which is taking care of all the other medical problems that the people of Brooklyn have.
Dr. Joshua Rosenberg is the hospital's infection control director, and he's an ICU physician. Last year, he took us through one of their 3 COVID ICUs.
So this is the 1-year checkup.
Yeah.
What's the evaluation?
I'm grateful how well we've survived. We had no clue what we were getting into then. But what's interesting is that as all the data has come out through the various research studies, a lot of the stuff we were doing back then, they're recommending now. And I'm still looking at this saying it's not completely done yet.
Nurse Ellis feels the same way about the virus, that it's not over yet, and she says she will never forget the fear of those first days.
Patients died much more rapidly and often than I had ever seen in my life.
What was your worst day?
I think every day was a challenging day. We were afraid. It was business as usual professionally, but it wasn't business as usual mentally and emotionally.
What didn't we see that went on behind the scenes?
The sadness, I think the tears, maybe even the aggravation and the frustration.
With what?
The unknown. COVID-19 has been the virus of the unknown.
The day after Nurse Ellis said to me last April, "I want what you have," I sent her my face shield. Right after we left the hospital, our team agreed it's the right thing to do. She told me she wore it every day at work for all of the 6 weeks she spent in the ICU. And she never really forgot that moment of seeing somebody walking in as a guest of the hospital, better dressed than she was, right?
Yes.
Yeah. So she never got COVID, by the way.
That's good.
And she's fully vaccinated.
You must feel good to know
great.
that, David. I remember that story very well. And when I saw you in that getup, I thought, God, that does seem a lot. But it was very alarming because nobody knew what we were dealing with, including the medical community.
Bingo.
It's hard to look at those pictures and realize even then in real time, we didn't know what is happening here.
Just remember, the key is they made a lot of progress last year.
Yeah, it was such a scary time.
Let's end on that note. Made a lot of progress. Thank you, David. Good to see you.